Hello, dear viewers of our channel. Today we'll learn how turnips can help with diabetes. We'll find out how turnips can aid in achieving clinical remission. At the end, we'll discuss how exactly to use turnips for this purpose. But before that, are turnips allowed for people with diabetes? The composition of turnips? How does it help lower blood sugar? How does it help with weight loss? Who should avoid it? And in what situations should it be eaten cooked or raw? We'll learn how and when to consume it. The glycemic index of turnips is 30. This is similar to cucumbers, cabbage, and zucchini. It is a product with a glycemic index similar to broccoli. Its glycemic index is considered low. There are about 6 grams of carbohydrates in 100 grams of turnip. Of these, less than 4 grams are sugar, about 2 grams are fiber, and the remaining 90 grams are water with about 1 gram of fat and protein. When cooked, the sugar content in turnip changes and decreases. It's not 4 grams of sugar anymore. Now, in 100 grams of cooked turnip, there are 2.5 grams of sugar. The sugar in turnip consists of fructan and sucrose. That is, it does not consist of glucose and fructose, as is commonly found in many fruits. The carbohydrates in turnip prevent blood sugar levels from rising rapidly. And that's the reason. In turnip, there are naturally occurring substances called glucosinolates, and these compounds help to speed up the liver's detoxification process, utilization of glucose, which refers to the way the body processes and uses glucose for energy. In 2019, during that year, an article published in the Journal of Medicinal Food discussed the consumption of turnip in patients with prediabetes showed a 12% reduction in insulin resistance. The fiber in turnip prevents glucose from being rapidly absorbed into the blood from the intestines, and the antioxidants in turnip reduce the cytokines responsible for inflammation in the body. Everyone knows that chronic inflammation increases insulin resistance. Consuming turnip reduces this chronic inflammation. There are 28 kilocalories of energy in 100 grams of turnip. That's very little. A person who eats about 200 grams of turnip won't feel hungry for 3 hours. They'll stay full. The fiber in turnip supports the microbiota to be healthy and well balanced. When the microbiota is healthy, insulin resistance decreases. When the microbiota is healthy, a person's craving for sweets also decreases. Nowadays, for the microbiota, there are a lot of attention is being paid to it. Microbiota refers to the beneficial microorganisms living in your body, which produce useful substances, vitamins, protein-like compounds, amino acids for you. These beneficial microorganisms are called the microbiota. If the microbiota is healthy, insulin resistance will be low, will decrease. Now, who should not eat turnip, and how to cook and eat turnip, and in what situations turnip should not be consumed, we will learn. If someone has gallstones, that is gallstone disease, or if someone has severe meteorism, meaning excessive gas in the abdomen or intestines, if you have a lot of gas or if you have hypothyroidism, do not eat turnip. You might wonder why it is not allowed in hypothyroidism. Plants belonging to the cruciferous family, their fruits or roots, reduce the absorption of iodine. That's why people with hypothyroidism, people should not consume a lot of it. How do we cook and eat turnip? Which ways are not allowed? Let's find out. You can add turnip to salads, boil it, then eat it, steam it, or add it to soups. And you can also fry it in olive oil or stew it. In folk medicine, turnip is often used together with honey or other sweets, but it should not be cooked and eaten with sweets. You should not fry turnip in a lot of oil. When there is too much fat, insulin resistance increases. The load on insulin rises. Now, how does turnip help treat diabetes? Let's find out. Turnip is considered a very beneficial product for people with diabetes, for diabetic patients. Because look, it reduces insulin resistance, it slows down the absorption of glucose due to its fiber, and it contains very little sugar. The sugar in it is different from the sugar in fruits and does not cause a rapid spike in blood sugar levels. The antioxidants it contains reduce overall inflammation in the body and decrease insulin resistance. However, you can't cure diabetes with just one turnip. Turnip alone will not cure your diabetes. It can help as a supplement to your main treatment if you consume it in moderation as part of your diet. Just eating turnip alone will not cure diabetes, as managing this condition requires a more comprehensive approach. Type 2 diabetes is a chronic disease that develops mainly due to hereditary factors, such as a genetic tendency toward insulin resistance, which means the body's cells do not respond properly to insulin. In addition, the patient may have other health concerns or risk factors that contribute to the development and progression of diabetes. Excess weight, hormonal imbalances, especially a decrease in the sex hormone testosterone, a deficiency of certain vitamins, especially vitamin D deficiency, an unhealthy lifestyle, and poor eating habits. Now, not everyone with poor eating habits develops diabetes. There are people worse off than you. There are people who eat even worse. They don't have diabetes. Not everyone with low testosterone develops diabetes. In this world, among people over 40, about 80 to 90% have low testosterone, but not all of them have diabetes. There are people who are more overweight than you and they don't have diabetes. Here, a hereditary state of insulin resistance is being observed. You have a change in your DNA. The receptors that accept your insulin and as a result lower the sugar in your blood, or the DNA that is primarily responsible for producing insulin itself, has a mutation. Mutation means a change in a person's heredity, their genetic lineage. Mutation arises as a result of internal and external factors. Mutation is passed down from generation to generation. Do you understand me? There are people with even lower testosterone than you. There are people who are more overweight than you. There are people who eat even worse than you, people who don't do any sports at all. But they don't have hereditary insulin resistance in their genetics. You might say that none of my relatives had diabetes before. But mutation can also be acquired during a person's lifetime in their daily life. Now, a mutation has appeared in you, and this can also be passed down from generation to generation. In the next generations after you, diabetes may appear. It's possible. Such changes cannot be treated with turnip. Turnip will not cure diabetes. Turnip helps to lower blood sugar. It contains little starch. That is, turnip is also included in this group. Low in starch, together with other vegetables that are low in starch, consuming white meat. White meat means fish, turkey, chicken, meat, and also rabbit meat. Along with these, eating turnip may help prevent neuropathy. It may help prevent diabetic nephropathy, may help prevent retinopathy, and may help lower glycated hemoglobin, and may help in diabetes remission. Eating turnip at lunch or in the evening, together with protein-rich foods for a period of 3 months, can help to reduce levels of glycated hemoglobin by 0.3% to 0.8%. If you consume it twice a day, that is, if you want to control your blood sugar well, your blood sugar may stay low and not increase, but you can't cure diabetes with just one turnip. Please remember this point. Stay healthy, stay well. I hope you understood me. Thank you for your attention.